Hello, everyone, and welcome to today's webinar. We're going to go ahead and get started. Today, you'll be hearing from Rey Gross from Centauri Health Solutions on correct codes utilizing the AHA coding clinic. Before I turn it over, I do want to go over just a few housekeeping items. So as you'll see here, just make note that your camera and mics will be off. So if you do have any questions, we do just ask that you put them in the Q&A box down at the bottom of your screen. We will be answering all questions at the end of the webinar. However, if we're not able to get to any, just know that the Centauri team is going to follow up with you afterwards. So without further ado, I'm going to turn it over to Rey.
Hi, everyone. Thank you for joining in today. As Bailey said, my name is Rey Gross, and I'm the Coding Education Manager with Centauri Health Solutions. So I want to first start off just to tell you a little bit about myself. I have a pretty extensive background in medical coding as well as medical billing. So I have done everything from starting off signing claim forms all the way through all aspects of coding, from provider auditing to teaching in brick and mortar schools, as well as where I am today in the education department. I love all things coding. I originally spent most of my time in profi coding, and in 2014 began in the risk adjustment side of things. So I really love what I do, love education more than anything, and am happy to share with you all. I've been certified with APC since 2003-ish. So a lot of what we're going to go over today will be kind of a combination of both aspects of all things coding, but with the emphasis going to be on talking about the AHA coding clinic and the uses. So let's jump in and get started. Love to know where all of you are from. So if you want to type in the chat just to tell me where you're from, that would be great. I'm sitting right now in Colorado. So for this presentation, we're going to start off talking about defining what the AHA coding clinic is and why we use it, why it's helpful for what we do in our day-to-day activities. I will explain why the AHA coding clinic should be used in your day-to-day operations for medical coding, and then really in all areas, in all departments. We're going to discuss why the AHA coding clinic should be used in conjunction with the I-10 guidelines. I'm also going to discuss the impact of not referencing the AHA coding clinic. And then also we'll talk about steps that your organization can take to make the AHA coding clinic an integral part of your operations. So there's a lot of you on here from many different backgrounds, many different walks of life, doing many different things. So traditionally in the risk adjusting environment, there's a heavy focus on Medicare coding as well as commercial coding. I do know that some of you probably do some work maybe in Medicaid, which is complete code capture. So I'm going to be introducing some of those topics as well. So how many of you do some work in complete code capture Medicaid in any aspect, whether you're an auditor, a coder, or maybe from the health plan side? Just kind of want to know a little bit about my audience a little bit. I've worked in all aspects in terms of risk adjusting, mainly started off on the Medicare side, worked in commercial, and really now I have a heavy emphasis on the Medicaid side of complete code capture. So I'm going to talk about things from both sides to hopefully help all of you out. So let's start off talking about what is the AHA coding clinic. Most of you, I'm pretty sure, are familiar with AHA in terms of your CPT book. Some of you that are providers or on the provider side, I'm sure reference AHA. But we also think heavily about the coding clinic itself, which is the AHA coding clinic advisor. And so, of course, as you know, the AHA stands for the American Hospital Association. The coding clinic itself is a resource that we heavily rely on to clarify different types of ICD-10-CM codes, as well as those PCS codes. So PCS, as we know, is for the procedural side of the hospital. Most of you on this call, though, are probably dealing more with the CMS side. So we're going to talk about that and how they help us to better capture those correct codes. The Coding Clinic itself is a resource that is updated quarterly, and it's used to clarify new as well as revised code. So sometimes there is a change in the coding description. Sometimes there's better clarification as these new codes are developed. What's interesting about ICD-10 is a lot of the codes are based around activity. So if you think back to when we had COVID-19 came out, there was a shift in adding additional codes. So things sometimes happen throughout the year. And the Coding Clinic is a really great resource for getting that information to us quickly. And then another really great resource that the Coding Clinic provides is they answer questions that are submitted by individuals or organizations. Now, when those questions are asked to the Coding Clinic, some of them will come out in publication, and we'll talk about some of those examples as we move through. But the really great thing is, if you're really uncertain about something, you can submit that question to the Coding Clinic. Anybody is able to submit questions to the Coding Clinic. You just go directly to their website. Some of those, especially I would say the questions that they receive often, are usually posted in one of the Coding Clinics. Other times you can submit a question and receive a direct response. So I've done that before. Something that we were seeing maybe a lot of questions on, or maybe coding errors on, so have submitted questions to the Coding Clinic. Sometimes it can take a while to get a response back, but you will receive an official notification, an official letter from them clarifying the answer to your question. It's important to know when you do submit questions, there's some criteria that you must have. So an example of a chart, it's usually not very benign questions that you would answer. They want to see some reference to properly answer you. We have actually taken some of our answers and included that information in our own internal documents that we use. And I've also used that to help with our coding for our clients. So for where I work, we work on the retrospective side of things. And so we're what I would call a vendor. So we work heavily doing retrospective coding. So a lot of our coding is done, in the from past coding, maybe a year or two prior. So it's really nice to have that information at our fingertips and have that resource available. So I want to do a quick little poll here. So my question is, does your organization utilize the HA Coding Clinic? So there's 3 different options. I'm going to give you a few seconds here to type in your answer to that poll question, and then we're going to talk about the different selections that you have. And there should be something popping on your screen. So just go ahead and take some time to answer to the best of your ability. So for those of you that answered yes, your department or your organization uses the HA Coding Clinic, that is fantastic. I think about the HA Coding Clinic is a supplement to our Bible. So our Bible being the ICD-10 book, right? That's where we get all of our diagnosis codes from. And so the HA Coding Clinic is a supplement to that Bible we have, right? So for those of you that are utilizing it, fantastic. Some of you may not be using it, and that is perfectly fine. So the purpose of this call today is talk to you a little bit more about the Coding Clinic, the benefits of it, and then we'll, see where you are a little bit later on. And there's an option for not sure, and that's very much the case depending on what department or what section of your organization you work in. You may not be aware that if you're using the Coding Clinic, some companies may give it to certain parts of some of their staff and not others. So you may not know, and that's perfectly okay. So, but we're going to talk about a lot of different things today. So let's first of all talk about using the HA Coding Clinic with your daily operations. So there's a lot of times where there are new codes or revised codes that are placed in ICD-10. And those sometimes are not very clear, especially if there is maybe a change in the description. So, for example, they may expand out the diagnosis code. So an example would be there's some new codes for migraines this year, for chronic migraines. So maybe it's something that you're not clear in the code description. They've added new additional codes to the code set, or they've taken a generalized code and they've broken it down. What's really interesting about ICD-10, new codes, whether they are brand new codes or whether they are codes that have been expanded to their code set, are normally driven by documentation. They're driven by providers. So, for example, you may have a provider sees a lot of a condition and they feel that that unspecified code is not completely capturing what they would like to describe. So they come together as a group and these new codes are created. So that's a really great tool. And so anything that you see in I-10, that code has been created based on the fact that there's been enough documentation or enough diagnoses that have justified the addition of new codes into the code set. Also, there are times where the indexing may be a bit confusing. So you're looking up a code and you really are unable to tell how to get to that code. You're not sure what direction to take. So that's what the HA Coding Clinic does, is it gives a little bit more detail. And we are going to look at an example in just a few moments here to explain some of that a little bit better. Also, your provider's documentation may not be indexable by default, and the HA Coding Clinic can help. And we're going to get into some information on that a little bit. So the one thing that I learned from going from being on the pro fee side of coding into what I call the retrospective or to the risk adjusting side, because a lot of times we are working retrospectively, is I started hearing a term when I got into HCC coding, which is I can't index that, right? And so that's always been a little confusing to me, or at least it was at one point. And I think that difference being that when you are on the pro fee side of things, you have the ability many times to query the provider. So you have that clarification because you're working then and there. On the retrospective side, we do look heavily at what is documented and what is sitting in front of us. And sometimes what is sitting in front of us doesn't equate to the indexing. Now, when it comes to I-10, we are also, as coders, directed that we should never code from the alphabetic index. You should always confirm in the tabular section. And the tabular sometimes will give you a listing of different, terms that you can use, but that doesn't always happen. And we're going to actually look at an example of that in just a moment as well. We also know that October 1st of every year, the new I-10 book becomes available. And you are notified of some of these code changes, prior to that. But that's that official magical date, October 1 of every year, where the new code set becomes available. The one great thing about the HA Coding Clinic is it is updated quarterly. So there may be items that are being addressed from the new code set. It could be something from earlier, but the Coding Clinic gives you that additional support all throughout the year. Also, there are times when I-10 itself will update throughout the year. So as you can see on my screen, I have some examples of times where there's been additional publications throughout the year. Now, if you're using solely a coding book, you're only going to have that resource that you have at the time of publication. Now, I find it to be important to make sure that if you're only utilizing just your I-10 book, you should go ahead and sign up for CMS, or at least at a minimum, review the CMS website for any of those, I call them mid-year updates, so that you have those. If you're using an encoder, and we're going to talk about encoders a little later on, but if you're using an encoder, most of that information is also pulled into your encoder so you can see. So for example, for the past 3 years, April 1st, there have been some updates, some revisions to either guidelines, added codes, clarifications to codes, etc. That those will show up, and they're also there again. They're visible either on the CMS website. So if you're that book user still, maybe use a combination of both, or if you're using an encoder, many times that information is also included within your encoder. So you want to make sure you're aware of that. The great news is if you are utilizing the AHA coding clinic, they also will alert you to some of these updates as well. So a moment ago, I mentioned to you that sometimes we have conditions that are a little difficult to index. You cannot index a code. You're looking at documentation and you can't index it. Now, again, the alphabetic index is your starting point. You should always verify the tabular. Sometimes in the tabular section, you are given additional information or different terms that you can use to get to what you're looking for. That's not always the case. So if you're looking at the AHA Coding Clinic from 2018 issue 3 or quarter 3, if you want to call it that, you will see that there's a condition that you cannot index. The condition itself we're talking about is pseudo gout of the knee. So if you try to index pseudo gout, you cannot get anywhere. Okay. However, there was a question that was submitted to the coding clinic stating that their provider was using the term pseudo gout of the left knee. And so I just changed up to just knee in general. So in this coding clinic, the question was submitted and asked, and the coding clinic stated that when pseudo gout of the knee is documented, we are able to capture M11269. Okay, and of course, the code selection being based on whether it's left knee or right knee, or if it's unspecified. But you are able to get to a term. Now you will notice on the snip that I have here, you do not see any reference to the term pseudo gout. However, it is a codable condition. Now, we use at our facility, in our department, we actually use Find a Code. So some of the snips that you're going to see from me are going to be from Find a Code. So in the tabular section of Find a Code, this is what it would look like, the M11269. And you will notice that's all that you have listed. You don't see any reference to pseudo gout. Now, you will notice that on the left-hand side under the little symbols, there's a CH. That's an indicator for being a chronic condition. So with that being said, if you were to see pseudo gout and you were to ignore that term because you were unable to index it, you might be losing out on revenue. So it's really important to make sure that you are looking through the coding clinic and looking to see if there's any terms. And we're going to talk about different ways that you can search and find what you're looking for most of the time. But this is a great example where if you were saying, I can't index that, you might find that you have missed out on a possible mapping code. So as you know, when you have either Medicare or commercial, the code sets are a little bit different. If you're working in a complete code capture, this is going to be really important because you're capturing all types of conditions when you're doing complete code capture. So wanted to point this out is my example for you have a condition, you cannot index, you cannot query, but Coding Clinic has advised us that there is a way to capture a specific code. I also talked a little bit ago about your mid-year or different times that there are updates. So this may be a little hard to see, but I wanted to point this out. So as you know, when October 1 comes, especially if you're using an encoder, you have your guidelines that are pulled into your encoding software. Now, you will notice that there's some information surrounding aftercare, which is located in chapter 21 of the guidelines. So what I highlighted is one word, which is solely. Okay, so you can see it says patient's encounter is solely to receive radiation. Okay, radiation therapy. Now, April the 1st of 2024, there was actually an update to the I-10 guidelines for Chapter 21, Section 7 for aftercare, and they changed the word solely to chiefly. Anytime there's an update, you're generally advised what the updates are. Many times it's either going to be bolded, it may be underlined, it may be marked out if there is something that they want to remove. So it's really important to make sure that you're looking at these updates. A lot of this information also will come out through the coding clinic. So there are times that information is being updated. So I know some organizations offer an encoder, but for some reason, and myself, I do the same thing. I still occasionally like to refer to my physical book, right? Kind of old school here. So still like to use that physical book. But it's important to know that one word could change your approach to something. So it's really important to make sure that you're referencing CMS, you're referencing your encoder, and you're referencing Coding Clinic to see when these updates become available. Again, Coding Clinic does only update quarterly, but when it updates on that quarterly cycle, you will see these updates come in. So just make sure you're paying attention to that, being very mindful. So now we're going to talk about the Coding Clinic and the ICD-10 connection, and I'm also going to provide some different examples of some things we're going to talk about. So all of us are familiar, or most of you should be familiar with excludes one. I have some individuals on the call that may not be, so I'm just going to do just sort of a brief explanation of excludes one. So within the tabular section of your I-10 book, you have either excludes one, or you may see excludes two. Excludes one is a time when you have two conditions that per ICD-9, they should never be captured together. Okay, so you have two diagnosis codes, and you are advised that when you have these two conditions and these two codes, they should never be captured at the same time. They do not coexist. So one code would take precedence. There's sometimes it's very clear. So if you have J439 and you have J449, so J439 emphysema, J449 unspecified COPD, we pretty much, those of you that are coders will know that there's an excludes one on those. And it's pretty easy to tell which one would be the more specified code, which is the J439 for the emphysema. There are times though that it can be confusing and you cannot determine which one is the most specified code. Now, also Coding Clinic is good because they also give an explanation. There's actually a Coding Clinic on excludes one that talks a little bit more about that. We're going to look at an example of an excludes one in just a moment, but I want to give that basis first. The Coding Clinic also a lot of times will reference when there's a code also note. So let's talk briefly about the code also notes. For those of you that are working in Medicare or in commercial, sometimes those code also notes do not apply because you're only coding from the mapping chronic conditions. So a lot of times we overlook the code also notes. For those of you that are working in Medicaid and you're doing complete code capture, you may be more familiar with looking at the code also notes because a lot of those code also notes are non-mapping conditions, but based upon your documentation should be captured. And there are some code also notes that also do contain those chronic conditions, so you want to be mindful. I think when it comes to traditional risk adjusting coding, we are so focused sometimes on the chronic conditions. We know what those codes are. We know them off the top of our heads. So we don't look as carefully year over year to see if the coding direction has changed, if the coding rules have changed. You know, we're always taught as certified coders that every year we should be looking at all of our guidelines when the new I-10 book comes on October 1. We're advised we should be reading the guidelines, looking at the new codes, looking at the revised codes. But we're all very busy, so sometimes that doesn't always happen. But it's really important to do that so that you're making sure you're appropriately capturing the codes properly. So we're going to look at an example of that in just a moment as well. We also have some confusion with the I-10 guidelines sometimes. A really great example of this that we'll look at in a moment too is when you have the term in or due to with the causal, you're like, what do I do? Sometimes it's clear, sometimes it is not clear. Example, when it's clear, we know about the causal. If you have diabetes and you have a with, you're able to make that link, right? So you know that causal, if it's something that falls under the with of diabetes, without the provider making that connection, you can. So you have diabetes, you have neuropathy. We know that that falls under the with, so we are able as coders to make that causal. That is defined within the I-10 guidelines. When it comes to CHF, hypertension, we know about those causals, okay? We know if we have CHF, we have hypertension, and we have CKD, and we have diabetes. In the absence of the provider linking those conditions, we have that causal, so we can make the link with CKD to both diabetes and to the hypertension and heart failure, unless the provider says that that CKD is related to the hypertension. Now you're given your causal. We're told within our conventions that when something falls under the with, we can do certain things. And we're going to take a look at an example in a moment. However, sometimes it's not very clear. So for dementia and epilepsy in Q224, we're given some guidance on how to appropriately capture that, and we are going to take a look at that. The coding clinic is also really good for giving coding scenarios as well as clarifications. So I think one of the biggest ones that probably not everybody moving was when we talked about coding from list or not coding from list or only coding from an active part of the record. Remember, risk adjusting is always about making sure that the provider is addressing the chronic conditions at least once a year. That's what we're trying to do here. So there was some guidance on making sure that the conditions were assessed at the visit. So the coding clinic actually came out with an update to their own directive. So they gave some direction on capturing those chronic conditions when they were addressed during the visit. There were some questions, they provided clarification. They also came out with a specific document on HCC coding in Q2 2022, which is a great resource. You also will find that they do clarifications of their own. So make sure you're looking at the coding clinic to see if there's any update to their own guidance. And they also will always link you back to the original clarifications as well. There's also information within the ICD-10 guidelines that gives information on, how do you code symbols? How do you code from, with, without? There's a lot of information that's contained in there. But the coding clinic also came out with clarifications on code assignment based on the up and down arrow in Q1 of 2011. So for example, you have an upward symbol and you have cholesterol. You cannot index cholesterol. And when you have the upward symbol, that doesn't mean anything. You cannot capture high cholesterol based on the upward symbol or, anything like that. So the coding clinic sometimes not only clarifies just ICD-10 codes, but there's also clarification on basic coding in general. And the next thing I'm probably going to say twice because it's going to sound very strange. So remember, ICD-10 is about capturing codes, but not how to capture the code. So let me say that again, because I know it sounds kind of strange to say that. But ICD-10 is about capturing codes, but not how to capture the codes. Yes, you have your ICD-10 guidelines. You have your notes that are within most of the different chapters. But the coding clinic sometimes has to fill the gap or make, do the bridge between something that is not very clear. You have everything you need in your ICD-10 book, but because we know that things vary based on how something is documented and a lot of different factors, that's where the coding clinic steps in to bridge that gap. So now we're going to look at a few examples here. The first, with the confusion of the excludes one. Now, I mentioned a moment ago, I used the example of emphysema and COPD. We can tell it's pretty easy to read that. But let's talk about the coding clinic that was just published in issue 2 a quarter to in reference to constipation and fecal impaction. Okay, so this is a new one, and this one is a little bit different. This is one of those tricky ones I was telling you about. If you look at K59.00, you'll notice there's an excludes one for K5641. Okay, now if you look at K5641, there's an excludes for K59.00 for constipation. There's an excludes one on both terms. So what do you do? So this was the reason for the coding clinic. There was a question that was submitted with this scenario presented, and coding clinic stated for this example that it would be appropriate to capture the K5641, and this is the reason behind it. Sometimes this is clear and sometimes it's not so clear. The first thing I want to point out, again, from Find a Code, you can see that K5641 contains that CH, which means it's chronic. That's a mapping condition in a lot of our projects. So that's something you want to be really mindful of. But what if you're in complete code capture and you're thinking, I don't know what to do because I have an excludes on one? When I'm talking about these two conditions, let's think about the assessment. So in the assessment, the provider documents the patient has constipation and fecal impaction, or constipation with fecal impaction. Okay, there's that excludes one that you're given, right? Coding clinic advises that if a patient has fecal impaction, the constipation is a symptom of fecal impaction, so they would both coexist basically, but your appropriate code capture would be K5641 for the fecal impaction. Since it's understood that if a patient has fecal impaction, they're constipated, right? But you could see where there could be some confusion, because if you're working in complete code capture, you may not be sure which to code, so you don't code either one because of that excludes one. You don't capture anything. So that would be an indication of undercoding. What if you weren't sure and you coded both because the provider documented that they had both? That would now be overcoding. So coding clinic has stepped in to advise which one is the appropriate one. When I think about these two conditions, and I mentioned the signs and symptoms, when you're working in traditional HCC coding, when you're dealing with chronic conditions, you're not as focused sometimes on knowing what the signs and symptoms are with a confirmed diagnosis, because you're looking heavily at those chronic conditions that are given to you. However, when you're working in Medicaid, it's very important to understand the signs and symptoms to know what's part of a confirmed diagnosis. So this one would be, I think, really beneficial on maybe both sides, but more so the side of my complete code capture, because if you're working in a mapping project and you have fecal impaction and it's a mapping condition, you wouldn't be concerned with the constipation anyway, since it's non-mapping, okay? So let's talk about the indexing when you have that. I'm going to talk about the code also, and the reason why there was a question submitted for asthma with COPD. Now, depending on how your documentation is written, depends on how maybe you search, how you index. We all index different ways sometimes. So we have two examples here. So you have asthma with COPD, referenced in the Coding Clinic 2024 Q2. If you were searching by COPD, and that's where your starting point was. And you can see in my index, you have disease, obstructive, chronic, with asthma. You're directed to code J449. That's how we've been doing it for years. We can all agree on that, I'm sure. Now, what if you're one of those individuals that's maybe new to coding? So you decide to search by asthma because that's your first given term. It's asthma with COPD. By searching through asthma, you have your asthma, then you go to your with, then you'll notice you have COPD, chronic obstructive pulmonary disease, and now you're given a different code of J4489. Okay, so let's look at my SNP all the way to the right. So this would be the description of J4489, which is other specified chronic obstructive pulmonary disease. You will first notice that this code was added October 1 of 2023. So let's talk about the importance of that. For those of you that have been around for a long time, and I know it's kind of a sense where we know we're supposed to look at the new codes, but we don't always do that. We know that. Your mind is set to know that when I have COPD and I have asthma, my code is J449. Okay. However, with J4489 being added, if you have COPD and asthma documented, unspecified asthma documented, the correct code as of October 1 of 2023 is now J4489. The coding clinic has referenced this for us. They told us that the question was submitted. If I search by COPD with asthma, I'm given J449. If I search by asthma with COPD, I'm given J4489. Coding clinic has advised the correct code is J4489. Now let's talk about one way you can kind of tell the difference. You'll notice that you have J4489 says other specified COPD. So that other specified is going to be that asthma, the unspecified asthma. That's all you would code is J4489. Now, I wanted to bring in here this code also note. You will notice that there's a code also if you have the type of asthma. So we're talking about, mild, intermittent, or mild or intermittent or severe asthma. If you have a specified form of asthma, then you would additionally code the type of asthma. That's where that code also note comes into play. So if you have, mild, you have intermittent asthma with COPD, you're going to code the J4489 along with your severity of the asthma. Or if you have, an exacerbation or something like that, you're going to code the specified form of asthma. It is inappropriate when you just have unspecified asthma. You're only going to code the J4489 when you have COPD with asthma. Other examples of those code also notes that you want to think about. If you're in a complete code capture project, for example, you may have, say, the patient has CHF, right? You will notice that sometimes if you're in a complete code capture project, it will have a code also note or use additional. You want to look at things like that, picking up, the smoking if it's documented, if they're a smoker, things like that. So always make sure you're looking at those code also notes. What I suggest is even if you have been coding for 15 years, every year when you get to a date of service that's October 1, take a quick look at that code to make sure that nothing has changed. Is your code still valid? Has your code been added into a new description? Has something changed? Because October 1, you would be coding inappropriate. For those of you that are working in retrospective coding, this is a little challenging because your codes will change from September to October. something different has happened, right? So you just have to be mindful of those things. If you're coding for previous years, you just want to make sure you're coding appropriately. Okay, so this is an example of one where I just wanted to point out there's a new code for asthma with COPD, and additionally making sure you're looking at those code also notes. Some of the code also, if you're working in Medicare or commercial, they are mapping, so you don't worry about it. But if you're in a mapping project, sometimes those code also will also affect your code capture as well. In my next example, I'd like to talk about the example of confusion in the with, in, due to, and those causal relationships. We talked a little bit about those a moment ago, but here I want to give you some examples of where you have your with and your convention sections, and it talks about the word with or in should be interpreted to mean associated with or due to when it appears in a code title, the alphabetic index under a main term or subterm, or an instructional note in the tabular list. So Coding Clinic has clarified something for us in terms of the dementia and epilepsy. So as you can see here, if you're going to index the term dementia, and you have the in, due to, or with, because we're advised in the conventions that you can use that terminology, you have epilepsy. And you're told if you have dementia and epilepsy, and you're going strictly from the alphabetic index, you might be confused to capture G40909 along with F09.80. Now, question was submitted to the Coding Clinic. Is it acceptable to make the connection when the provider has not connected them? So your documentation is going to drive this. However, Coding Clinic has advised that in the absence of the provider making that causal between dementia and epilepsy, you would actually code J03.90 and G40.909 separately. So in other words, you are not going to make the causal of the dementia and code the 0.80. You will code the unspecified dementia along with the unspecified epilepsy. Okay, so that's the clarification that Coding Clinic has provided to us. One thing that I think about is we are given several causals, which we just talked about, but we're given the causals specifically to diabetes conditions, to the COPD, to hypertension and CHF. We're given those causals, right? We're told those. Outside of those, for the most part, your provider needs to make the connection based on their documentation. We are not clinicians, and unless we're told according to I-10 what is a causal, well, we don't need the provider to make the connection. The provider would need to make the connection, even despite what you see in your coding convention. So just think about what your documentation looks like to drive this information. And again, if you have a question, submit to Coding Clinic. That's what they're there for. Okay, so let's do our next poll really quick here. So based on our discussion so far, how more likely are you to use the AHA Coding Clinic? So I'll give you a few minutes or a few seconds here to provide that information. You know, just based on what we've talked about so far, what's the likelihood that you'll start using the Coding Clinic more? So I know we're getting some responses in. So like I said, I'm really excited to see what your thoughts are and what we've discussed so far. So let's talk a little bit about the selection choices here, right? So you have more likely than your current use. So that could be because you've had the Coding Clinic, but you just weren't using it very much. So I'm hopeful that some of what we've talked about here today has maybe convinced you to start using that resource a little bit more. It may be about the same. There's no change. Maybe you are like me, you are kind of a geek and a nerd, and you've just been using it all the time anyway. Okay. I will say I have used it more so within my HCC background than previously. But it's my supplemental Bible, so I do use it all the time. Maybe definitely you're going to use it more because you weren't using it previously at all. You had it, you just never really used it, or you weren't familiar with how to use it or why to use it. And some of you still may not be convinced at all. Like you just want to see more. So we're going to talk about that. So we have about 15 minutes left. So we're going to get into the maybe give you a little bit more information that will entice you to use a little bit more. So let's talk about the impact. Okay, so what is the impact by not using the coding clinic? So that possible loss of revenue. So thinking back to that pseudo gout, remember there was no way to index it. It's a mapping condition. You may have missed that code. So possible loss of revenue. You also have the possible over or under coding. So let's think about the scenario that we had with the dementia and the dementia and the epilepsy that we talked about. Let's think about the fecal impaction and constipation we talked about earlier. So that could result in some possible either over or under coding. But how about investing in the coding clinic? So what would that impact look like? So correct coding resulting in proper reimbursement. So you're able to you're able to better perform in your coding. So you don't have to worry about losing money when you submit your claims, whether you're an HCC coding, whether you're doing complete code capture, whether you're doing Medicare or commercial. So you're going to have some correct coding. You're not going to have to worry about later on about maybe CMS kicks something out. Okay. Or maybe you're thinking, gosh, if I had really known that, I would have coded if I had just looked at that coding clinic. And then we talk about, clean claims being submitted. That's all we want, right? Is for our claims to go correctly to CMS. I always think about whether you're on the health plan, whether you're CDI, whether you're a coder, you're an auditor, whatever area that you're in. At the end of the day, we want everything to go out as clean as possible. I'm going to talk now to my coders and auditors for a minute. For those of you that are coders and your claims are being audited, I'm sure you want nothing better than not see any rebuttals come back to you, right? Or you don't want any errors to come back. So I think about if you utilize these resources, that will better help you later on down the road. So how can you make the coding clinic a part of your organization? So we're going to talk about a few different things here. First, test it out if you're not using it now. They do offer a trial. You just simply provide, your email address and sign up for that trial. So test it out to see if it's something that you think you should be using, even if you're not necessarily a coder or an auditor or CDI. Health plans think about it. You have vendors working your claims. You need to make sure you understand the impact. It's not really just for coders for the organization, but to help all the way around. You really need to decide what is best for your specific organization. What works for you for one organization may not work for another. So there's a couple of things we're going to talk about briefly, but you have the print version, or also known as the digital version. And then also you have an add-on that you can use, and we'll talk about add-ons in a moment here. So what is going to work best for you? Having simply the digital format. So digital meaning that it's on their website. It looks like a newsletter publication. You flip pages, navigate through it. Okay, so it's like just having an e-newsletter. I'll term it. Add-on is where it's built into your encoder, and we'll talk about that in a second here. Who will have access to it? So in our organization, initially, only our QAs and above had access to it. We took the step to provide it to our entire coding department. So coders have it, auditors have it, management has it, everybody has it. And it's the best thing we could have done. One problem that I have and have always had is if I'm going to provide information to someone, I want everybody to be level set. I don't want to give advice to a coder or to an auditor or to any individual and provide them the resource that they cannot see and they do not have. So we provided to our staff so that we could say, okay, there's a coding clinic, you did something incorrectly, or we're educating on something per the coding clinic. They can go to the clinic themselves and they can see it. One thing that's really important to make sure that you understand is that when you have the coding clinic, you are not allowed to screenshot, you cannot plagiarize, you have to actually change the verbiage. They have in fine print in their terms and conditions that if you are screenshotting email, you can actually lose your own login. So you don't want to take a risk by doing that. You want to make sure that, you're changing up. You can refer to it. I've given you the examples of where to go to, but you don't want to do screenshots, email copies of it, things like that. So it's a little bit of a cost up front, but I feel like it's better to level set and provide it to everyone within your organization so that when you are providing that guidance, everybody has the same information. You level set. I've even noticed that some of the coders, when they're aired on something and they send their rebuttals in, they will reference something on the coding clinic. My department in education, we handle all of the coders' questions. We handle all of the coders' rebuttals. We also handle even our clients have the ability to do rebuttals. And so because of that, we utilize the coding clinic. And when we provide that feedback, we're able to reference that source where we found it, right? But I definitely think that you need to consider your organization may not be able to afford to give it to everybody, but do take that into consideration when you make your decision. So we talk about having an add-on to your existing program. So for example, I mentioned we use Find a Code. We have as an add-on. That's a really great benefit because we're not having to jump over to one website for Coding Clinic, another website for our encoder. Everything is built into one. What I love about having it built in as well, the Coding Clinic, of course, they're different publications. So if you're looking from something, you may have to jump between publications. If I take the term diabetes where we have our add-on, it will pull up every single coding clinic that references something about diabetes from the most current one all the way back to, I believe it's 1987 or 88, which was the first publication. It will pull everything up. You can sort it by, last year, 3 years, anytime, whatever you want to sort by. So I love having it built into the system because I can search by wellness exam. I can search by heart failure. I can search even by a code number, and I can start to search it, and I'm all within the same platform. So that's something you may want to consider. Most of the more popular encoder programs have that available to them. So Find a Code, Encoder Pro, HCC Coder, for examples. What I highly suggest though is before you do an add-on package to the coding clinic, to contact different encoder softwares to see which one is more cost effective. Some of them you pay an amount for each individual that has it. There are some where you pay per account. So it would behoove you to, check around, do your homework before you do anything. Now, as I mentioned, that you may want to level set to where everybody has access to it. So we do, our department, as I mentioned, we handle all the coders' questions, the rebuttals, and so forth. So because we handle all the coders' questions, they can do minor research, but our department does all of the legwork. We do, they submit a question, we do the research. We don't want them, we know that coders and auditors are generally working on production, so we don't want to take that time away. And so because of that, we do the legwork. So if you have a training department or a division that handles the majority of the research, What you can do is provide coding clinics to everybody for research, for a resource, but let your training department maybe push out notifications of things that may be relevant. Let me give you an example. Even though the coding clinic is based around I-10 guidance, there are some references to, say, for CPT or procedure coding, which isn't relevant to what most of us are doing here, right? So if that is the case, then if you're trying to figure out what to do, you maybe don't want the coders looking at everything. So I will push out coding clinic notifications. Okay, so the asthma and COPD, that's relevant. The dementia and epilepsy, that's relevant. ACC coding, using the upward downward syllables, that's relevant. So we will go through and notify of coding clinic updates. Sometimes we do a little snip. We don't copy and paste what's from the coding clinic. We may change the wording a little bit. And we do have a section in our SharePoint that says, here's some tip sheets and their coding clinic references. So we guide the coders to the same ones we want them to see. Or when we provide feedback, we will reference the coding clinic so they can look at it. So you may want to have your training department push out updates or notify those, major changes that would be relevant to your coding environment. But don't take shortcuts. So meaning do not share your login. As I mentioned, coding clinic can be on the pricier side. I think that's why some organizations don't have it, but don't share your login. Again, in their terms and conditions, if you're sharing your login, you may lose the ability to even have the coding clinic. So it's just not worth it. So don't share your logins. Again, I've mentioned already, don't copy and paste, but most importantly, do reference it often. It is a great tool to utilize. So you do want to make sure you're using it, every day. You should be logging to it every day. You should be referencing it consistently. So here's some resources that I have, just where some of my information came from. I hope that the information I've provided you has been useful and beneficial. I hope that maybe this gives you a better understanding. I hope that if you didn't know anything about the coding clinic before, I've taught you a little bit. I hope that if you weren't using it, you will be, or if you were using it, maybe you have some tips that will give you a better understanding. So thank you so much for your time today. And I'm going to pass it back over to Bailey for a bit here.
Perfect. Thank you so much. And thank you to everyone for attending on behalf of Rise and Centauri Health Solutions. I am going to go ahead and launch our webinar experience survey. So if you could just take a few moments to complete this questionnaire, just let us know how we did. But again, thank you so much to our sponsors at Centauri for putting on this great webinar today.